understand outpatient physical therapy and how you can obtain a referral. So I am in outpatient orthopedics, which means I see people usually ages 40 to 70. I see total joints, spine, shoulder, hip, knee, balance, deconditioning. So I kind of see it all. I wouldn't say I see the sports medicine injuries as much, but I certainly see younger or older people for a whole variety of aches and pains, and we do that right upstairs here. Before I was working in outpatient physical therapy, I was working as an inpatient physical therapist. So some of you look a little familiar, but it's nice to see you all in street clothes, not in the green hospital gowns. But I worked inpatient in the surgical intensive care unit for a little while, and then on 3 Southwest. So if you've had your transplant here at Froedtert, you might be familiar with that floor. And then for about a year, I worked with Dr. Kim on a liver transplant prehab research project. So we developed a program that ran for 12 weeks on strengthening before a liver transplant in the hopes to build up your strength before you go and have that major surgery and have that inpatient stay and you're not feeling well, and the more muscle you have to lose, hopefully the better you feel on the back end of it. So that's what we did with Dr. Kim, and that's still going on, but I'm not involved in that anymore. So just a little bit about physical therapy. The goals of inpatient are for your medical management and to get you home safely. So I ask everybody if they've ever had physical therapy before, and if you stayed inpatient, you probably had physical therapy. But I probably walked with you down the hallway and made sure that you could do stairs and get in and out of bed, and that was that. But outpatient physical therapy, we're really looking to decrease your pain and disability and improve your quality of life. So that could be knee pain, back pain, or it could just be general deconditioning that's preventing you from going to the grocery store and doing your own shopping. So if you feel like you fall into those categories for outpatient physical therapy, we'll talk a little bit later on about how you can go about getting a referral to physical therapy if you feel like the things that we talk about tonight just aren't enough for you specifically. So I don't need to lecture you about living with a transplant because you're doing it, but I know you're taking a lot of medications for immunosuppressant, and they've got a whole list of side effects, and that's why I'm here, because we want to minimize the side effects that you're feeling. So some of those that I pulled off a long list of side effects are muscle or joint pain, constipation, weight gain, weakness, stiff neck, low back pain, increased cardiovascular complications, and the list kind of goes on, and we talked about how important the bone and joint health is. So because of some of those medications, you just have to work a little bit harder on some of those things. Then you're also undergoing some tests to monitor your organ function, like the heart tests, the electrocardiograms, echocardiograms, and pulmonary function tests for your lungs. So we'll talk a little bit about the exercises that target the heart and lungs also. Very briefly on diet. So consult a dietitian if weight loss is your goal, but because we're going to talk about exercise, I just want to mention that protein is the building block of muscle. So eating meat, cheeses, beans, whatever you want to do for your protein source is important. If you're expecting to build muscle, you have to have the building blocks in your diet. So it doesn't matter to me what protein source you like, but know that feeding your body is important if you're expecting to build muscle. And then the 3 types of exercise that you will talk about tonight are aerobic or endurance cardio exercise. That's more for the heart and lungs. We'll talk about strength training quite a bit. And then we'll talk a little bit about balance because that seems to be a issue that comes up time and time again when I'm seeing people after transplant. So with anything, there are some risks and things to consider. Normal response to exercise might be that you have muscle soreness. We're hoping that we prevent any type of overuse, injury, or equipment accidents, but those things can happen. But just in general, when I talk to my patients about muscle soreness, I might expect you to have soreness that lasts 12 to 24 hours. But I would say if it lasts more than the 24-hour period, that's too long and that you overdid that exercise, and we'll scale it back next time. But that's kind of the guideline that I use. But I would expect muscle soreness when you're training those muscles and trying to build strength. Certainly we're preventing overuse, injuries, and equipment accidents. So if you're ever uncomfortable with any equipment that you see at the gym, ask someone so that you don't, cause an injury there. One thing to consider is osteoarthritis, which is part of the normal aging process. I see a lot of patients with knee and hip arthritis, and they come to me really upset because they got an x-ray that said that they have degenerative joint disease. And then we talk about what that means. And it really is part of the normal aging process that can start when you're in your 20s or 30s. And it's just the normal wear and tear on your joints. But what we do know from studying x-rays and MRIs is that just because you have arthritis in your joint doesn't mean that it has to hurt. So we'll talk about the exercises that you can do to kind of support the joint strength, especially the major muscle groups. I'll show you some exercises for that. And the benefits of exercise with osteoarthritis, I think, certainly outweigh the risks. So decreased pain, improved physical function, improved quality of life, and improved mental health are all benefits of exercising with osteoarthritis. So if you have had an x-ray of your knee or your hips or whatever, and it says that's degenerative, probably everyone in this room is old enough to have a little something going on. So I'm not going to worry about that. Diabetes is another one to consider because exercise may decrease your blood sugar. So make sure you check it as recommended by your doctor and recognize the symptoms if you have diabetes of when you're feeling like you have low blood sugar. And again, this isn't my area of expertise, but some of my patients will just plan to eat a snack or something ahead of time to prevent that from going low while you're exercising. And then with any exercise, especially with diabetes, check your feet, make sure that there's nothing bad going on because you can prevent a lot of problems just by taking a look. So the exercise guidelines that I'm going to talk about are put out by the U.S. Department of Health and Human Services. Their most recent update was in 2008. They call it the Physical Activity Guidelines for Americans. And they classify adults as age 18 to 64. And we'd like to see 150 minutes of moderate intensity aerobic exercise. So aerobic exercise is the endurance cardio exercise that raises your heart rate, at least 10-minute increments. So I'm happy that they added that 10-minute increments in because that's the goal that I always set. 150 minutes is really daunting when you're doing 5 or 0 minutes of activity, but if you can build yourself up to at least doing 10 minutes, then we start to see some benefits of that. And we'll continue to talk later on about what aerobic exercise is and what moderate intensity means. The second piece that they recommend is 2 times per week that you're doing strength training of major muscle groups. And those same recommendations apply for adults age 65 and above. So I think that captures our entire audience. Those are the targets for the U.S. population. And I pulled a quote off of their website, which says, when adults with chronic conditions do activity according to their abilities, physical activity is safe. So if you were thinking, I've got arthritis and diabetes and I don't know if this is safe for me, I think that kind of captures it. That also might be a reason that some of the things we talk about tonight is beyond where you're starting at tonight. And then I would encourage maybe a specific referral to physical therapy if you feel like you don't feel safe doing any of the things that we talk about tonight, or you're not sure where to start and this is all too overwhelming for you. So the U.S. Department of Health and Human Services has a committee that analyzes all the best available research and puts it all together so you don't have to go out searching for everything. It's all put together by the experts, and I gave you the link to the guidelines in case you want to read and see exactly what they say. They rate the evidence that they find strong, moderate, weak. So I pulled out some of the pieces on the strong evidence for exercise. And it prevents weight gain, prevents falls, prevents developing type 2 diabetes, prevention of coronary heart disease, improved cardiorespiratory and muscular fitness. So if I haven't convinced you yet, there it is, the activity guidelines for Americans, that exercise is good for you. So the first type of exercise we're going to talk about tonight is aerobic exercise, or you might be familiar with cardio, endurance exercise. And remember, that was 150 minutes, at least in 10-minute increments of moderate intensity. So when I read through the guidelines, I didn't know what moderate intensity meant, so I think it's worth defining for you. Moderate intensity can be measured in a couple different ways. We can track your heart rate, and that's calculated based on your age. And then we can also rate your perceived exertion. So the moderate intensity is important because if you're working too little or too much, we're not getting the desired effects. So if you're working in the moderate intensity range, at least in the 10-minute increments, that's when you start to see the benefits on your heart and lungs. So more efficient pumping of the blood by your heart, and more efficient breathing and getting oxygen to all of your muscles by your lungs. So if you're able to track your heart rate, you can follow this calculation, which I won't make you do tonight for yourself, but you have the example if you feel like calculating it. Heart rate is the best way to track your intensity because it would be probably the most accurate for you. However, in addition to all the other medications you're on, you may be on a medication that prevents your heart rate from rising too much. So then we wouldn't use this to gauge how intense you're working. And that's why we have the scale on the next slide that I'll show you. But if you're able to track your heart rate, you can wear a Fitbit, which is super convenient, then you don't have to feel your pulse. But there's a picture on the bottom of the slide where you put your index and middle finger on the thumb side of your wrist really lightly and feel for that pulse. And to determine your heart rate, you count how many times you feel that pulse in a minute, or you can time it for 30 seconds and multiply by 2. But that would be your heart rate. We track it in beats per minute. So to find the maximum heart rate I would want you to achieve with intense exercise, you do 220 minus your age. But because I want you working in the moderate intensity, you'll take 50 to 70% of that. So the example on the bottom of the screen shows the calculation for a 50-year-old. So 170 is the maximum heart rate. But I want you working at 50 to 70% of that. So when this person, this 50-year-old, is exercising and they're tracking their heart rate, we're targeting 85 to 119 as the heart rate. So if it shows up on your Fitbit, or if it shows up, you know, just take a minute rest, that's where I want you working to get those benefits for your heart and lungs. If you're one of the people that you can't feel your pulse, or you're on a medication that's kind of blunting the heart rate raising effect, you can rate your exertion on the scale. So I asked the question, how hard do you feel your body is working? And the scale goes from 6 to 20. And I won't go into the details on why it's from 6 to 20, but that's the way it is. But moderate intensity, you'd rate yourself anywhere from 12 to 14. So 13 means it's somewhat hard. Sometimes when I'm working with patients, I'll just try to hold a conversation with them, and you should still be able to hold a conversation if you're working at moderate intensity, not that you're so out of breath that you can't hold a conversation. So moderate intensity is the recommended guidelines. If you are comfortable working at a higher intensity, there's no reason not to. Some people really want to, run, or if you're lifting weights, your heart rate might go above that, but then just come back to that max heart rate, and that's really where we want you to peak if that's what you're doing, higher level activity. So types of aerobic exercise you can do. You guys, if you were here last month, it sounds like you had a talk about walking, and walking gets an entire slide because I think it's underestimated the power that this can have for you. First of all, you have to walk to get anywhere you want to, so you may as well be good at it. Probably walking at a little bit more of a brisk pace to get your heart rate up into that 50 to 70% range that we were just talking about. And the benefits are you don't need any equipment, and luckily I'm not here in December when it's starting to snow. I'm here in March when it's starting to get warm, so you can get outside and walk. But it is sort of a weather-dependent activity, and if you don't feel safe in your neighborhood, or you don't feel safe with your balance, then maybe you're not as willing to get out and walk. But there are optional pieces of equipment for walking. Also, a treadmill. You can see the girl on the treadmill up there. People ask me about treadmills sometimes, and I don't think it's any better than walking outside. But if you already walk with an assistive device and you're worried about your balance, I'm not going to put you on a treadmill where the ground is moving underneath you and then you're going to fly off the end if you stumble or if you need a break. So walking on normal level ground is just as good as walking on a treadmill. And then trekking poles are kind of trendy right now. I don't know how well you can see the picture of the people, but trekking poles are adjusted for higher than a cane would be. And especially for people who have had, some of the heart and lung surgeries or the liver, everything, all those scars kind of really pull you forward. So trekking poles get you more upright, and then when you're walking with them, you get a lot of trunk rotation. And if you're, not wanting to take your walker or cane out in your neighborhood, they look kind of cool. So I've had patients bring me trekking poles, and then we adjust them for their height and practice walking with them in the gym. And those are kind of nice. Other aerobic exercise, if you belong to a gym, you might see all of these options, and they're all fine. I say pick what you like. I don't really have a preference. The elliptical might give you a little bit of the same effect as the trekking poles might. A recumbent or stationary bike is fine. The new step is pictured on the bottom, which is a really great bike. It's more like a recumbent stepper, and they have them at the Wisconsin Athletic Club and the YMCA. So if you have achy hips and knees, this is the machine to seek out. They have 2 of them here, I know, and they also have them at the YMCA, but it's a really gentle motion. And I gotta say 95% of my patients probably do that, and they're willing to come early to physical therapy to ride that bike because it doesn't give them that joint pain. So that's a really good one to look for if you are at the YMCA or Wisconsin Athletic Club, because I think they have some affiliation with the Arthritis Foundation, so they have that machine which is a little bit more gentle on the joints. And the last one that I have listed up there is swimming. So again, with arthritis, swimming or just simply walking quickly in the water is really good. Unloads the joints, feel nice in the warm water. If you have any swelling, it compresses your legs. So those are all options. I say pick what you like. If nothing else, walking is good. All right. Next category we'll talk about. Anybody questions so far on aerobic? Stop me at any point. Yes.
The I can use them in place of a cane.
Maybe. Oh, I'm sorry. The question is, can you use trekking poles in place of a cane? I wouldn't tell you specifically yes without assessing you, but I have had patients use that in place of a cane, yes. Yeah. Yes.
I want to ask you, now being a transplant and a diabetic, I take 17 pills in the morning and I take 10 in the evening. And when you were speaking about the heart rate, this is every day of my life. I take my own my blood pressure, I take my temperature. There are times when with my meds that those be a lot of times it'll throw me off, it'll put me back on. They're not going to take any more of my meds away. This is it. I have to live the rest of my life with this. I'm 72 years old. I'm seeing everything up here. You got up from what, 65 to 70.
Mm-hmm.
You know, the aches and pains. That's automatically. The balance. That's every day of my life that I'm up and down stairs. Or when the bad days is when I can't go outside, I know how to walk through my house. I have found a way to walk through. I don't have no treadmill, but I know how to walk through my house enough times from room to room, which is just as good when you can't go outside.
Absolutely. So walking through your house is just as good, yes.
And also, by living on the second floor, I'm up and down my stairs.
Yes.
Which gets my heart rate 4 or 5 times up and down the stairs to get my heart rate. Then I can do exercise up and down with my arms and things.
Right. I like it. So, sort of a question, mostly comments, I think, that use what you have. So he's walking back and forth through his house, which is perfect, and walking up and down the stairs, which I didn't list as an exercise, but I think that's a great exercise, just going up and down your stairs, because you also get the strengthening in your legs, not just the heart rate benefits of going up and down the stairs. So those are really good points. Anything else about the aerobic exercise before we move into strengthening? Okay.
Oh, Allison, I have
Yep.
a question here. So, is there such a thing as too much aerobic exercise? I've been told that after 20 minutes of aerobics, it changes to strength training. Is that correct? You have to.
Okay. So, is there such a thing as too much aerobic exercise, and does it change to strengthening after 20 minutes? I think that staying in that moderate intensity range is a good guideline. I think that if you are working beyond that, then it might turn into, for example, if you're just going up and down the stairs as your aerobic exercise, that might then become more of a fatiguing exercise for your legs and all those major muscles. But too much aerobic exercise is not proven. I just heard a talk, I think it was a year ago, from a cardiac doctor who presented all of the research that, you know, your heart only has so many beats to beat in your lifetime, and so why wear it out doing cardio exercise? And that's not true. So I think that there's no such thing as too much, but I think maybe too much for one person could be true. So I go back to that, you know, everyone can exercise if the dose is appropriate for them. I hope that answers the question. Okay, so let's talk about strength training. Again, we'll go back to the guidelines. 2 times per week of for strength training of major muscle groups, shoulders, legs, hips, and back. So after a transplant, you have deconditioning just due to inactivity and that whole healing process, and then the side effects of medications, which we talked about before. And I think some of you specifically mentioned osteoporosis, so that your bones are getting a little bit weaker, and that's where we can really have an impact with strength training. So when you reach your peak bone mass, pretty early in your adolescence, but what the strength training can do for you is to prevent a quicker decline or to help maintain what you have. So that's what we're going to talk about with strength training. There's all different kinds of strength training options for you. Body weight or weight bearing is always my preference because loading the bones, so standing up on them, is what prevents the bone loss. So if you love doing exercises laying down, I'm not going to stop you because something is better than nothing, but if we're talking about just bone density, I really want you to do exercise where you're standing up and putting weight down through your legs. Swimming is really good, but when you're walking in the water, you have unloaded your bones, so it feels great for your joints, and do that for the benefits of, exercising comfortably and raising your heart rate, but that might not be the best exercise for you if you're trying to load the bones and prevent that decline there. You can use resistance bands, ankle weights, free weights, and machines. All of those are kind of added on top of this. So what I mean by weight bearing or body weight exercises, some of those are pictured there. Even just, squatting without the medicine ball at all is a body weight exercise, or doing a lunge. That guy on the left side picture is doing push-ups on the table. All of those are more functional. You don't need equipment because it's your body weight, although you can add things like weights and balls, and it does promote bone strengthening. So if you're comfortable with your balance in stand. Question.
So I have a desk job, and I know that there's a big trend right now in stand-up desks.
Yeah.
Do you have any evidence that that's a good idea or bad idea?
I don't have evidence for that. Oh, sorry, stand-up desks at work. Any evidence for it? I don't have evidence. I don't know if there is evidence. I had one patient with neck pain and migraines, and she switched to that, and with physical therapy and that, it resolved. Sometimes the way that the keyboard and monitor raise isn't, so when you're standing or sitting at a computer, I'll just say I want the top of the monitor to be in line with your eyes. So that's where I would adjust the height there. And then the keyboard should rest comfortably here. So hopefully those two things move separately. And it's better, I would say, in general, probably for your posture. I've seen it, you can even walk on a treadmill while you're standing at your desk, which is kind of nice. But I would get dizzy. I'm not sure. I don't have evidence for that, but you have that, huh?
I just want to work it down.
Do you? Yeah. My patients that like that are the ones that get back pain from sitting longer or neck pain from being crunched over. I don't know if it has any effects on this part of things, like strengthening body weight. Yeah. Anything else before I keep going? Okay. So things that you can add on top. Resistance bands, relatively low cost. You can do those at home. They can add a greater challenge to exercises. I would say I use them a little bit more with upper body things because you're a little bit more limited with what you can do in weight bearing with the arms. And then free weights or ankle weights can be added on some of those exercises that you may be familiar with from physical therapy before, the handouts that you got in the hospital. But the exercise that the guy on the left is doing, laying down, would not be a weight-bearing exercise. So he's working on hip strength, which is really important. I give that exercise to people all the time because strong hips control what happens down below at your knee. But if you're wanting to just load the bones for strengthening of the bones, in general conditioning, that's not the exercise that I would pick for you. If you have knee pain, I might have you do that exercise. And then the machines, if you're going to a gym, all of these are fine to do. I put the picture of this one, that knee extension on here, because people ask me about that machine all the time, and it builds your quad strength, which is fine, the muscle on front of your thigh. But if you already have knee pain, I wouldn't put you on that machine. And if you love it already, I would only go about 50% of the range. Once you get your knee all the way straightened out on that machine, it gets a little bit more unstable, and that's where people tend to get more pain. So if you love that machine, I would just go 50% on it. The leg press, this one in the middle, is an alternative to that, and you use a lot of the major muscle groups in your legs, and that would be my preference over just straightening your knee. And then the girl in the pink tank top, she's doing hip exercises on the machine. Okay, stability balls are another one that I get all the time. It falls into the same category as the treadmill. So if you're already a little off with your balance, don't sit on a stability ball. Okay, there are other things that we can do. But if you have one and love one, there are all kinds of different exercises that you can do on that for your back, your core strength. You can do leg strength. The girl in the picture there is doing a little bit of a back strengthening exercise on there. So don't place yourself at injury risk just to use the ball. But if you have one and you talk to your physical therapist or someone at the gym about it, there's tons of stuff that you can do with that. We talked about the YMCA and the Wisconsin Athletic Club, and I picked those two out only because I know they have that new step machine, that recumbent stepper, which is really gentle on the knees and hips, and that's one of those cardio machines. They also keep their pools at a little bit warmer temperature than a high school would or some of the other gyms do, so it's nicer to get into a warmer pool, I think. But also if you're having those achy joints, the warm pool does feel a lot better. That's the only reason I pulled those two out. Senior centers have a ton of programs. The ones that we talk about a lot in physical therapy are Tai Chi and yoga. And they also have some aerobic classes and stretching classes that are really good. So if you don't want to exercise by yourself, I think that's a great option. A few of the high schools offer memberships to their pool for a little bit lower cost. So if you just wanted to get in the pool, I might check out some of the high schools. Also, high schools offer their gyms sometimes at a low cost membership. So if you didn't want to go to a big place, those are other options. Community recreation department programs, also really good. You can find yoga, Tai Chi. There's a arthritis foundation one that I saw in the Wauwatosa program that just came out for the summer. So if you're a resident, again, if you don't want to exercise by yourself, look for those things. I think they're really good. Okay, so anything else with strengthening? Questions? Yes.
The one on what you just got through with. Do you know that prednisone deteriorates, gets into optic help? Optic? Am I pronouncing it right?
Say it again.
Prednisone deteriorates the bones.
Right.
Okay. Maybe a lot of people don't know that.
Mm-hmm.
But that's the med by being a kidney recipient. Prednisone deteriorates the bone to give you Osteoporosis.
Osteoporosis, right. Yep. So prednisone, your point is that prednisone is one of the medications that deteriorates the bones. We also, on the inpatient side of things, when you see a physical therapist, we kind of pull that one out and make a point about prednisone that it, yes, it causes, can cause osteoporosis, but also proximal weakness, so weakness in your shoulders, core, and hips. And so when you're weak in your hips, it's really hard to get up off of a low chair. You don't want to get stuck on a toilet somewhere where you can't get up. Those are really low, right? Yeah. So, but that's true. You have to think about those things, and something that you don't plan ahead for. But working on hip strength is something that we always work really hard at in physical therapy. So even just doing an exercise as simple as sit to stand over and over again from a low chair is one of the exercises that I love to have people do, and see if you can get that time faster and faster, because you don't want to rely on your arms pulling you up. And if you did get on the floor, you've got to have strong legs to get you back up.
What muscles are you using then? So what muscles are you promoting in one sitting position to build yourself up?
To get back up, mostly your quads and then your glutes. Yep. And if we have some time at the end, I have a couple exercises picked out if anyone wants to take, try some stuff out that I kind of like. Anything else with strengthening? Anything online? Okay, so balance. I'm bringing up balance, not necessarily because it's a side effect of medications, but there are components of balance that kind of start to decline just with older age, but also with deconditioning and inactivity. And balance is one of the things that you can train and make better, no matter how old you are. I see patients, 80, I think the last one I had was like 89 years old in outpatient physical therapy, and she just wanted to work on her balance. And we did some exercises both that she could do at home and that we did in the clinic that you can improve your balance. So if balance is your only complaint, I still think it's worth bringing up to your doctor and asking to come see a physical therapist, because we always want you to feel safe when you're training that too. Balance, so feeling dizzy or lightheaded or the room spinning is not a normal response to activity. So if that's happening, sit down first of all. But if that continues to happen, I would definitely bring that up with the doctor. The room spinning feeling can be vertigo, and that is actually something that physical therapists treat. Or if you get, when you roll over in bed and you get dizzy, and then the room starts to spin, that can be an inner ear problem. And actually physical therapists, not me specifically, but there are physical therapists that treat that. So I just wanted to bring that up because that's another reason, another thing to talk to your doctor about, that there's something to do about that. You don't have to live with that. That's awful. But balance has components of vision, proprioception and sensation, and the vestibular, the inner ear part. So vision, we can't do so much about that, but the proprioception, where you are in space, and we can't change sensation, but those vestibular, proprioception, the vestibular are specific therapists, and proprioception is what we work a lot on, probably in physical therapy with the balance exercises that we do. So we'll do, if anyone wants to stand up, if they've been sitting for long enough, you can stand up. Let's do it. Everyone stand. It's too long sitting. If anyone is at home, stand up and make sure you have a table or something next to you where you can hold on. Really simply, screening that I might do in the clinic is just if you can stand one foot in front of the other. You should be able to hold that position for 30 seconds, and it does make a difference which foot's forward. If you don't feel safe doing this, don't do it. No accidents tonight. You got your legs crossed. You're overdoing it. Heel toe. One way is always better than another, so I always check both ways. And you should be able to hold that for 30 seconds.
And if you can't?
And if you can't, then we will work on it.
Oh, okay.
Practice it. That's it. Practice what you want to be good at, right? So if you can't hold it.
matter what hand is done, like if you're right-handed or should you
The leg that's back works harder, so right-handed people sometimes feel that the right leg back is easier. Struggles.
I'm not struggling. It's just been a long time.
Yeah, right?
I had to do all of this.
Yeah, I bet.
After I got my kidney transplant, I stayed in for 90 days.
Oh, wow.
I had to go to a facility. The hospital helped me, but I had to go to a facility for 90 days. I had to go through all of this.
Okay,
So
got
I
it.
know.
Keep practicing. All right, stand normal. The other thing that I would test is standing feet stationary. See if you can reach forward 10 inches. How far can you reach forward? You should be able to do that without falling forward. Everyone looks pretty good. Pretty good. Nice. Okay, come on back up. So not too bad in this room. Have a seat. We'll get you up in a little while. So practice what you want to be good at, right? So that tandem stance is an easy exercise to do at home, and you could, safely do that standing next to a sink, in a doorway, next to a counter. Toe taps or a book on a stair, the stair in front of you. So a higher stair is harder. So if you're standing at the bottom of your staircase and you have a railing, just tapping your foot up on the bottom stair, but pretend you're, tapping on an egg that you don't want to squish. So I don't want to hear boom. Okay? Yes.
You know how they taught me years ago what you're speaking on how to tap. When you tap, go back on this heel and you hold on and you go tap up, tap back, tap up, tap back.
You got it.
Okay.
You got it.
Going up, tapping up, coming down, tap back.
Okay, so you're just going up and down, tapping.
You want to make sure you're not doing it too hard, put a real weight on it.
That's true. You could put it under Terry's foot, make sure she doesn't crack it. Then who's going to clean it up?
Thank you.
The last one I have up there is just standing on one leg and pretending you're tapping the clock all the way around. Well, not all the way around, but you can get to like 6 or 7 back behind you. That's a little bit higher level balance. That's a good one for athletes. I have some golfers who cannot keep their balance, which is so important for golfing and your golf swing, but you can't balance on one leg getting all the way around the clock. So if the other ones were too easy, give that one a try. And I did touch on Tai Chi and yoga. Again, good group classes that work on balance. Tai Chi especially good for balance. Stretching. I'm just talking about these 3 major muscles because they get tight when you sit or work at a computer or sit in a car and drive. So the hip flexors are the muscles on the front of your hip, right in front. So if you're sitting, they're in a shortened position and they get kind of tight. So the easiest stretch, you want to try them? Stand up. Let's stand again. Too much sitting. Not for you. Don't stand if you don't want to do it. Okay, so everyone at home, we're on the first stretch, the black and white picture that's hip flexors. So one leg is forward, one leg is back. Hold on to something if you need to. The back leg is the one that's stretching, and you're lunging forward into the front leg until you feel that pull on the front of the hips, okay? So try not to let your back arch as you come forward. Keep that nice and straight. You should just feel the front of the hips stretching. And when you're doing a stretch, hold that for a good 30 to 60 seconds. All right? Then you can go ahead and sit back down. If you sit right on the edge of your chair, you can prop one leg out in front of you. The leg that's out in front of you, keep that knee straight. Come to the edge of the chair you're sitting on. Sit up nice and tall, back straight, and you're going to lean forward at your hip. Don't let your back curl. And then again, you should feel the pull now in the back of your leg. Keep the knee straight and hold that for 30 to 60 seconds. So again, the hamstrings get kind of tight when you're sitting for a long time. All
I
right.
got one for you.
Yeah?
Question.
Okay, question.
When your quads are constantly tight, your thigh is constantly tight, when you bend forward, I get to like here, and I feel it in here. What causes that? What's the cure?
I have a couple, so the question is about quad tightness, especially with bending forward. There's a couple different reasons that could,
IT band, I guess.
the IT band's on the side of your leg. Yeah. There's a couple of reasons that things like that could be going on, and it gets a little tricky up in your leg because the back can refer pain to that area. You have blood supply, nerves and muscles all running on the front of your hip, so and then of course your hip joint. So that can refer pain into the area. So I don't want to give you an answer and be wrong without evaluating you. But that, I think that's a fair reason to ask for a referral to physical therapy, truly, because there are things to do about it. Yeah. Anything else?
Allison, there's
Yes.
a question online about what is the tandem stance.
Oh,
So can you kind of step back
sure.
through the slides?
Yes. The tandem stance is just standing heel to toe. So one foot in front of the other.
We don't really have a slide.
Yeah, we don't have a picture of that. I might have a picture coming up. Let me just see. Yeah. That guy that's standing with one foot in front of the other, that's the tandem stance, like you're on a balance beam. Okay, so where are we? So we're wrapping up the talking part of today. So we've talked here and there about getting a PT referral. At Froedtert, we require a physician order for you to come see a physical therapist. There are private practices mostly that will see you without a referral from a physician, but persistent joint or back pain, the thigh pain, balance, the vestibular things we talked about, like rolling over in bed and getting dizzy, or just simply general deconditioning. I see people for, back pain, hip pain, shoulder pain, neck pain, whatever. And it could be because you're crunched up in a hospital bed, or you're just deconditioned and your body started to move differently and then you just didn't get out of the habit of moving that way. And we can help you with those things. I see plenty of people just for general deconditioning after a hospital stay. You're at a higher risk for infections. So you might have gotten hospitalized for the flu because it's a bigger deal for you, and spending a couple of days in bed is a bigger deal for you. And so I see people just for a few sessions to get them set up on a home exercise program to set them in the right direction again. So talk to your doctor if any of these things seem to be a persistent issue for you, and I'm happy to see you here. Anybody can see you for those conditions. All you have to do is ask your doctor, and if you're in Froedtert, they'll put it into the Epic system and it gets filtered through and you can see someone specifically for that. So balance, if you don't feel safe doing that on your own, certainly ask for a referral. If any of the things sounded overwhelming to you or you don't know where to start, ask for a referral. Just ask for what you need. Any questions right now? I think that was, I have, just some useful websites. So some of the resources that I used, we talked about the Physical Activity Guidelines for Americans, that top link. The Centers for Disease Control, the CDC, gives a little bit about activity basics, and then measuring intensity, moderate intensity, calculating your heart rate, or it has that scale, the Borg scale on there. And the Arthritis Foundation, I just discovered, is wonderful. I have no disclosures. I don't work for them. I don't get anything, but they're great. They have a nice website, and they have some exercises with videos on there. So if pictures don't do it for you, or you're not close to anywhere else to go, check them out. They also had, I discovered links to classes that you could go to also. So nice website. Yeah. Now let's see. Okay, so I'm back to kind of the moving around stuff. So that's all I have as far as me standing up here talking and lecturing you. I have some slides of exercises that we can try together. If you don't feel like it, that's all right. You won't hurt my feelings. But Cindy, did you want to wrap up at all this part of it?
Yeah. Are there any questions either from the online audience or anybody else in here?
Yeah. Yeah, sure. So the question is about needling. Dry needling is what we do in physical therapy. I don't personally needle, but one of my coworkers here does. A couple of them in sports medicine do that at the other clinics. So dry needling is using really fine needles like acupuncture needles applied, so using the Eastern technique in a Western application, basically. So you may have heard it for like trigger points or like a tight muscle. Sometimes they use it for scar tissue. So the Eastern application, like acupuncture, follows the meridians of the body, and they put the needles really superficially in your skin to do, you know, whatever they think they're doing. I'm sorry, it works. If you believe it, it works. The Western application, so dry needling and physical therapy, would be to find a tight muscle or scar tissue, and then to, put the needle into the muscle, so deeper, and kind of the muscle sort of resets. It kind of, grabs on the needle, you feel a little spasm, a little twitch. It may reproduce your pain. And then then they pull the needle out and it feels better. So there have been some, actually the research is, coming out, month by month on the dry needling, and I think anecdotally people have had really good effects. Sometimes people have a short-term effect, so you feel better for a couple days, but then it doesn't carry over. So we always follow up dry needling with strengthening, stretching, mobilizing the joint, getting you to move better, because I think if a muscle is spasming, there's a reason for it, trying to give you stability or fake strength where you don't have it. So then we try to follow that up with that. I don't know, have you had it specifically?
No, I just heard about it.
Yeah.
I wanted your perspective on it.
Yeah.
Based on your experience, how safe it is or useful it is and how effective it might be from your realm.
Yeah, right. I think that people who are really sensitive to pain to begin with don't do well with it because it's sticking a needle into something that hurts already. But people have had good results with it too. And as far as safety, the therapists go through hours and hours of training, and then, hours using the needles in the clinic, and they don't do anything over the rib cage because you don't want to stick a needle and puncture the lung. But other than, especially in the legs, there's, you're not going to hit anything really, so it's pretty safe. There are some, for people with osteoporosis, it's not recommended. Pregnancy, cancer, there are people that you wouldn't use it on, but a general healthy population, it's been safe for. Yeah.
Yeah, I wanna ask you, it's been quite a while for me, but I haven't forgotten. Therapy here at Froedtert Hospital, before that you can even get away from here, we had to walk the stairs. They would take you down and you had to go up those stairs, and believe me, they're not one or two. You had to go up the stairs and come back down.
Mm-hmm.
Even being in the nursing facility, you had the bed, you had to get in, you had to make sure you know how to get in, and you know how to get out. You had to button your shirt, put your pants, put your belt. If you had shoes to tie, you had to do all of these things to meet.
Right, the minimum goals just to go home, right?
So I haven't forgotten any of it.
Perfect.
So I was just wondering, right now, when I go and visit, I forget to ask, are they still walking the stairs? I was on 4 Southwest, so I know 3 Southwest is the same.
Yep, there's a lot of stairs in the hospital.
And, you know,
Good exercise to continue.
oh,
Yeah.
And also Froedtert therapists, they are the best.
Well, thank you.
Because when they used to come down,
He gets
they come to
paid.
get you out of the bed. Regardless of what you had to say, you coming up out of here.
That's true.
And
We're very
really
persistent.
Down the hallway, this is what you're holding on, and they're taking you.
That's right.
Whether you liked it or not, have to give them their props.
Thank you so much. What was your question?
Yeah, I do have a question. So just today in the mail came our high school summer adult enrichment program. So I was just going through it. There's something called foam rolling.
Yeah.
What is that, and is that good?
Okay, foam rolling. What is it? Is it good? Oh, I wish I had one here to show you. So,
Foam rolling 101.
yeah. Foam roll is about this round and then this long. Foam rolling is used as an alternative to stretching, I would say, for muscles. So you gotta look up a YouTube video probably to get the gist of it. But you can simply lay on the foam roll and let yourself kind of stretch out that way. But the rolling part would be, to lay, if you imagine like a rolling pin almost, but much bigger, that you lay on, and then you kind of roll yourself around on the ground up and down on that. It's not for strengthening, it would just be for stretching. It can be kind of painful to do. Yeah. Yeah, okay, that's it can be very relaxing just to kind of lay on it, or you kind of get some of the spots on your back worked out. But I've bruised myself on a foam roll because it's like it hurts so good. And later I had a bruise. But yeah, it's just kind of a self-massage stretch for muscles. Yes.
On that note, what about massage and coupling it? How is that
Massage, I think.
good to kind of also?
Sure. What about massage? So I think that massage is great. Massage feels good. I think along the lines of the dry needling, if it's like this chronic tension that you have to keep going back to get worked out, and maybe there's a reason why it's chronically in tension, and that it's worth looking into if it's really something that bothers you. A good reason to come see a physical therapist, but I don't think that there's any contraindications to massage unless you're on a blood thinner. You bruise really easily if you're not checking your INR and it's a little high. You might not want to get a massage, deep tissue, come out with all the bruises. Yeah.
Any
All right.
questions here in the room? Any questions online? Well, I think we'll just say goodbye to our online guests. I just want to remind both the folks in the room as well as the folks online that both the PowerPoint and a recording of tonight's program will be on our website, kidneywi.org, and it will be under the programs Living Well Before and After Transplant. I think here in the room we're going to enjoy a few more moments with Allison, but we want to say goodbye to our online audience, and please let us know what you thought about tonight's program, and certainly any suggestions. Folks in the room, before you leave, be sure to give us your thoughts on the evaluation form you have. So we'll say goodbye to our online audience. John will be closing down the webinar, and we'll enjoy a few more moments with Allison here in the room. Thank you.